Perfect. So welcome everybody. The format is fairly casual. We actually had our Associate Dean for Research was going to be here, but she got called away to a meeting with the President. So when the President calls, you obviously have to drop everything. So we are presenting just the two of us, my colleague Ling and I, and basically we want to just share with you a little bit about what we're doing over in social work, in the School of Social Work, some of our projects, introduce a couple new faculty that we've just recently hired in gerontology, so you can hear a little bit about their work, and then open up to a little bit of pending time discussion about ways that we could better leverage collaborations between the College of Nursing and Health Innovation and the School of Social Work. So to begin, I want to talk a little bit about our school. Ling and I have been there since 2013, so this is our 5th year. Even since we have been there, it's grown a lot. Certainly, I think nursing is one of the larger schools here, but in social work, we actually have grown quite a bit in terms of our students as well as our faculty. So we have over 40 faculty. We just hired 7 new tenure track faculty this last year, so they're joining us this fall, and we're looking to hire, I think, between 4 and 5 new tenure track faculty. Oh, 6! Thank you, Dr. Jordan, 6 for this year. So we are growing. We are really enhancing our research infrastructure. Part of that is due to the great work of our Assistant Dean, Dr. Holly Slater, and our new Associate Dean, Dr. Zhen Cong, and then all of us. And so we're really looking forward to sharing with you today a little bit about our work and about areas where we might better collaborate. So hopefully everyone knows about social work. I didn't really think to ask that. Anybody not know? Sometimes people think social work is just about children and families, and certainly that's a large part of social work, even in our school. But social work really is looking at solving social problems, whether it's at the micro level, with individuals, whether it's the meso level with certain groups or communities, or the macro level with policy. So for today, we're really focusing more on that health and / aging component and part of our work. So we do have a new research on aging group that we formed because we actually in total now have 6 faculty that are in gerontology. So it's a great big number, mostly assistant professors at this point. Hopefully we'll be getting tenure in the next couple years. And then we have Dr. Cong, our associate dean, actually is gerontologist as well. So we have a group that's forming. We have some sort of synergy groups we formed. We have faculty mentoring new faculty. We're looking for other faculty, though, across the campus to come to some of these synergy groups. We talk about projects. We have PhD students come in. We work with them. We talk about grant proposals, articles, all kinds of things. So if you're interested in any of those synergy groups, let us know. And we're going to go over today some of our current projects that we have going. Some of them have finished, some of them are just starting, and just share some ideas about ways to better leverage collaboration. So for me, I have sort of 3 areas of research that I have been focusing on. Some of it started before I came to UTA, but a lot of it has come about since I've come here. As a clinical social worker in practice, I worked a lot on interdisciplinary teams, particularly with nurses when I worked in nursing homes and assisted living. But as a researcher, as a doctoral student, I didn't actually have a lot of opportunity for interdisciplinary collaboration. So I was really fortunate to find a position here at UTA where that is the focus of our university. Interdisciplinary collaboration is so important for our university as well as for funding. So faculty here who have funding know how important that is. For doctoral students who are looking to take faculty positions or research positions, they're really looking for interdisciplinary teams that really enhances, I think, your proposals. So I have some areas around technology and aging. Certainly, we all know how technology is changing everything from our healthcare system to, just about anything, including transportation issues that I also look at. So I'll talk a little bit about those projects. I've gotten very involved in transportation equity for older adults. So the Department of Civil Engineering here at UTA actually has basically given a kind of 5-year window of grant money where they're looking at collaborations that involve transportation research. So some of you might say, well, I'm in nursing or kinesiology. What does my work have to do with transportation? But you're nodding. So there's a lot of intersection with our clients, with the patients you serve. If people don't have transportation, they're not getting to their doctor's appointments. They're not getting out of their house. They may become depressed. They may become isolated. So there's an important intersection between health, transportation, and for me, aging, but also other populations. So I'll talk a little bit about those collaborations, and there is opportunity for many in this room probably to pursue some collaborations right here at UTA to compete for some external funding. And then dementia caregiving is sort of my final area of focus. As we know, Alzheimer's disease and related dementia is a growing concern and problem in our country and really around the world. Family caregivers are the leading providers of care and support for these individuals. These individuals are not typically in nursing homes and assisted livings. They're being cared for at home. So our family caregivers really need a lot of support because there's a lot of challenges as well as some positive aspects of caregiving, but there are a lot of challenges. So some of our work, Ling and I's work, is focused on that. And really, I think just for myself as a researcher, I really focus on community-based research. So I'm very interested because I'm so rooted in my professional identity as a clinical social worker and doing things that impact the community. And a lot of this has to do with primary data collection. Now that's certainly not all the gerontology faculty, but just in my own work. And then I really feel like my work has been greatly enhanced by interdisciplinary collaborations here at UTA. So Ling and I have both partnered with for social work, liberal arts, and UTARI, which is the UTA Research Institute, with some of their computer scientists and social robotic research scientists, around a couple projects. Both of these were funded by an interdisciplinary research program grant, so UTA really focuses on having faculty apply for these grants to get us to work together. And then I was able to receive the President's Fellowship for research in this area. So our first study that actually has been completed, I'll tell you a little bit about, is about social robotics as a platform for interventions with older adults. So we partnered with liberal arts because, believe it or not, I don't think Dr. Greer is here, there's a faculty member there who specializes in creative arts, social robotics. It's a very interesting match, but she has a lot of expertise in this area. So we came together and wanted to look at designing sort of a small, very small intervention to take place in a residential care setting for older adults using a social robot to improve mood. We looked at mood, we looked at loneliness, we looked at depression. So because she's in theater and she has expertise in theater as well as social robotics, we designed an intervention where the robot at the top, the one that's red, the robot's name is Now, and Now actually performed a Shakespearean sonnet with the older adult individually, and then the last rhyming couplet the older adult performed. So it was an individual intervention. We did it 3 times over the course of 3 weeks. So we came back, we did it once, came back the next week, came back the next week, took measurements pre and post every time. We had standardized questionnaires, but we also did qualitative interviewing after. And what we found is in the sample that was just those without cognitive impairment, because we're still looking at the persons with cognitive impairment data, that their overall level of depression did decrease, and they were highly engaged and receptive to Now. So we did a kind of a video analysis. We videotaped all the interactions, and then as a team had sort of a structured way to systematically analyze social engagement or engagement. Our community partner for that was Brookdale Arlington. That was in sort of our first phase, which we followed up the second year using the President's Fellowship money to look at residents at Brookdale Pecan Park. So those are older adults with cognitive impairment. And like I said, we're still looking at the data. But that was a fantastic study, certainly very exploratory, certainly innovative and creative. Our hope is that we'll be able to, from some of these projects, and actually Ling has another one we'll talk about with social robotics, we'll be able to go for something like an R21 or something like that, or maybe someone will pursue an R15. Our second study that we're working on has to do with intergenerational activity. So we really want to, because actually Ling's expertise is in intergenerational relationships, we wanted to design some sort of activity kind of or small intervention to look at ways to enhance relationships between older adults and younger people. So we are talking about this robot here at the bottom. His name is Pepper. I say his, it's really not a he or a she, but It's whatever you want to read into it. He's actually a larger robot. He can actually move around. He has his touch screen. So we're actually working on designing some sort of interactive kind of cooking activity, thinking that cooking is a good way for grandparents and grandchildren to reminisce about the past. So we're looking to recruit college students and their grandparents and have them engage in this activity. So we're going to measure, again, things like mood as well as social connectivity, and look at some more measures around kind of intergenerational enhancement and social relationships. And that's currently happening this year. We'll be kind of doing the design now, and we'll work on recruiting in the spring. So if any of you see the flyer and want to be a participant, we'd love to have you if you're a student. Transportation equity in older adults. So I mentioned already the partnership with civil engineering. Dr. Steve Mattingly over there, and there's another new member, Dr. Kate Hune, specialize in civil engineering. And as I'm learning about civil engineering, I'm realizing it's very broad, and you can do everything from looking at freight, which I wouldn't have any idea what to do with something with freight, but fortunately over there, they're also interested in looking how transportation affects real world problems, communities. For me, from my perspective, about how do we create aging friendly communities. Certainly, as you know, or maybe you don't know, that Arlington is the largest metropolitan area in the country without public transit. So we have a whole host of problems in our community for all ages, certainly mothers and their children and families, but also in, of course, my interest in gerontology, we have problems with older adults and their family members. So we actually worked, we had funding from the Transportation Research Center for Livable Communities, which is out of Western Michigan University, to custom design an app to actually measure transportation, what we call transportation disadvantage, among older adults, and really looking at their needs, as they're very neglected in transportation planning, because typically transportation planners design for the people that are going to and from work, all of us. They don't design for the people, the individuals, the communities that aren't necessarily going to and from work for a variety of reasons. So we created this app, MyAmble. It captures both quantitative and qualitative data, and we use what's called an ecological momentary assessment, meaning it's a daily diary. So it's kind of more longitudinal data for 14 days. And we're really looking at this from both the quantitative, as I mentioned, we had certain measures. We asked about even things like, how does this trip impact your well-being? But we also had an interactive feature, which is pretty interesting, using a qualitative text messaging feature where we asked the older adult questions about transportation disadvantage. We found that was one of the most engaging parts of the study. The older adults really responded well to having what we called a travel buddy, and Vivian is back here. She was a travel buddy, where myself, or one of the GRAs partnered with the older adult participant and would text message back and forth with different questions that we had related to social exclusion, this framework of social exclusion. So that's been a great opportunity, and as I mentioned, there are more opportunities even here at UTA now with the University Transportation Center, Dr. Steve Mattingly. And there are some folks over in CAPFA, I believe, doing a lot of transportation work as well. But we're hoping to apply for some other grants, because this was a small sample of 10 older adults. We had 20, but 10 dropped out due to mostly health reasons. So we're trying to sort of look to see if we can expand this and pursuing funding to do so. And our community partner for that was Meals on Wheels of Tarrant County. So I try to highlight our community partners as much as possible, because in social work, because we have such a field component. I know in nursing there's also a practicum or something similar. We really do have a lot of relationships with community partners and agencies that are very eager to talk about research, bring their research ideas to the university. And I think one of the great tools in the social work toolkit is that we have relationships with those folks. And we feel comfortable collecting data with vulnerable and disadvantaged populations, because we're trained as social workers to do that, and our students are as well. So the graduate research assistants are very key partners in all of these projects. And finally, the dementia caregiving that I mentioned. So this is the R15 that Dr. Fidel mentioned. We just recently got on September 15th. So we're still a little bit in shock and happy. But our interdisciplinary team is social work and also College of Nursing Health Innovation. Dr. Dacia Seifer is our biostatistician on this project. So we're very excited to begin working with her. We are working on what's called the Senior Companion Program Plus. It's a psychoeducational intervention for African American dementia caregivers. So what we know from the research is that African Americans are disproportionately affected by Alzheimer's disease and related dementia. We also know that many family caregiver interventions are not accessible, affordable, or sustainable. So Ling and I actually embarked on a pilot study where we worked with the Senior Source in Dallas. They have what's called the Senior Companion Program. It's been around a long time. It's a federal program that matches low-income seniors with other low-income seniors as volunteers. So these are individuals who want to get out of the house, be civically engaged, and they go and volunteer somewhere between 15 and 20 hours a week with another older adult, with the idea of trying to keep them out of nursing home care, because we know how costly that is, and that's not preferred. So we partnered with the Senior Companions in Dallas, train them on the intervention, and this is actually a lay provider intervention. So the Senior Companions, we train them, then they go out into the homes and they work with the family caregivers one-on-one for 9 weeks. What we're trying to do, and what we saw from our pilot study, is very promising results related to decreasing caregiver burden and stress, enhancing social support. We also carefully used focus groups to help with African American Senior Companions to help sort of adapt an existing intervention that was done in the community but led by professionals. So we have actually adapted it for use of lay providers. So as I mentioned, it's a weekly 60-minute sort of a module that they go through face-to-face, and focuses on everything from education about Alzheimer's disease to behavior management, communication, skills, and anything that, you know, that the research has shown and that based on some of the expertise of the Senior Companions is going to enhance meaning, including spirituality, for this particular population that we know from research and we know from conducting focus groups. So our community partners for this project are actually in Texas as well as Louisiana and Arkansas, so we could have a large enough sample. So we're very excited. It's a 3-year grant to get that started really soon. But you can sort of see from these 3 projects, and I'll pass it to Ling, where we've been intentionally collaborating, really leveraging as much as we can those opportunities for collaboration. But I know there's more room, as you can even see from the projects I've mentioned. Really only one has, you know, your college involved. So there's a lot of opportunity in the future moving ahead to find ways that we can, you know, work more together. Okay, Ling.
Okay, good afternoon. I'm so happy, but also very nervous to be here to share my research. So broadly speaking, my research is about aging health. So I can group my research into 4 areas based on ecological system theory. So I'm very interested in how macro systems such as the culture or social norms affect the aging health. And also I look at how exosystems such as social service and neighbors and programs, how that affect the aging health. And also look at how microsystem of family, intergenerational relationship, and peers, friends, as well as individual systems such as age and gender, how that affect aging health. So this is general my research area. But since I'm a social worker, so I pay more attention to the larger social systems. So in today's presentation, I'm going to just focus on the first 2 areas of my recent research. The first one I'm going to share is about look at the cultural construct of intergenerational solidarity and caregiving. So this is a collaboration between School of Social Work at UTA, Noelle and I, and a School of Nursing in Rutgers University in New Jersey. So in this study, we combined 2 longitudinal data sets in Chicago. So one is from for older adults. The other one data is about their adult children caregivers. So we combine these 2 data sets and look at. Actually, we have 3 different steps. So first, we look at we develop a caregiving solidarity. So this is the middle part. So we want to look at whether and how the traditional 6 dimensions of intergenerational solidarity fall into the latent construct of caregiving solidarity. For example, the first two solidarity, associational and affectual solidarity will help answer, do I want to provide care for my older parents? So we call that willingness. or whether consensual, functional, or normative solidarity will help answer, will I or should I provide care to my parents? So we call that obligation. And also structural solidarity, we call that availability or capability. So after this model is developed, we are going to look at how the acculturation factor affect the caregiving solidarity. Because for minority immigrants, when they move to the United States, they have better acculturation than their parents. So we are looking at how the acculturation level of adult children, as well as the acculturation gaps between children and parents, affect the development of caregiving solidarity. And lastly, we want to look at how acculturation and solidarity together influence caregiving behavior and their well-being over time, and also whether this influence is based on the parents' cognitive impairment, cognitive function over time. So because this is 3 weeks longitudinal data. So this is very interesting. We submit this to NIH in June. We're waiting for the response or feedback in October. Hopefully we can have some score. But we have preliminary data analysis to show that actually the last content, the last construct, the capability actually play a major role in children's decision to be a primary caregiver for older adults. And that's very interesting because that will provide evidence for our next study, such as intervention about long-term distance care when the children has problem of availability or capability, right? With the help of technology, that will be a concern or of a next step. And also our data also show actually for adult children, caregiving well-being such as burdens, depression and life satisfaction, actually the middle part, the obligation solidarity actually play a larger role in that part. So that also may provide evidence when we design the intervention in community. We may call for norms of solidarity or call older children to provide caregiving solidarity when they care about their parents, because that's beneficial for their well-being. So this is more like minority immigrant family when they care more about the cultural norms, when that's a central piece of their daily life, and the cultural piece that will be very important for their caregiving behavior and well-being. So this is the first study. We collaborate with external, source or university. And the second one, Noelle just mentioned that, is that we recently have a study called Socially Assistive Robotics for older caregivers. So this one is a collaboration between social work, UTARI, liberal arts, and Department of Kinesiology. So Dr. Priscilla Tacola is in this project. So this study was funded by Nadler, and we got the subtract from Georgia Tech. In this study, actually, the primary aim for this study is to develop SAR caregiver model for older caregivers when they care for their adult children with developmental disability. So in this study, we have generally 3 stages. And the first stage is we call that pre-demonstration. So that after recruitment, after all they sign the consent form, we have pre-test. We ask about their both the caregiver and care recipient, their demographic background, their experience with robotics, and their general well-being, both physically and psychologically. And then we're going to do a focus group. We're going to do that this Friday. So we're going to separate the caregiver and care recipient into different groups. And we already created a video that's an introduction about Pepper. We already saw the picture of Pepper in Noelle's slides. So we're going to show both groups the video about how Pepper looks like, how Pepper can do for caregiver and care recipient, and then we're going to ask their opinions about both caregiver and care recipient. For example, from caregiver, we're going to ask their expectation about what's respite care and whether they're comfortable having care recipient alone with robotics. and how this program can provide recipe for caregivers. And also we are going to ask care recipients separately about how SAR, this model, can provide what kind of enjoyable activities or stories or engagement, whatever, they can provide their feedback and opinion or expectations. So based on that, after we collect all information, we're going to move to a second stage. We call that programming. So experts in engineering and utility, they will help us to put programs based on the opinion and feedback from caregiver and care recipients. And after the second stage, we are going to go to the third stage that's called demonstration and post-test. So we are going to have individual interaction between the care recipient, I mean the children with disability, with the robotics, and for 15 or 20 minutes. And after that, in the meantime, the caregiver will go away for 20 minutes, or if they are not comfortable, they can still stay in the same building but different location, I mean another room, or watch a screen to show what's going on in the demonstration room. So that's okay, but after that, we're going to have a post-test. So we have both quantitative and qualitative post-test to ask their experience about their interaction with the robotics, their trust for this robotics, as well as their burdens, experience, their the motion, and also their stress, anxiety, something like that. So this is the study about SAR, and we hope after this pilot study is done, we can get some interesting results, and we're going to move on to enlarge this to a larger population or even more multiple location or site. So this is the second one, and the third one is also about minority. It's about healthy aging among older minorities and their family caregivers. So this one was funded by UTA Research Enhancement Program. So generally, Noelle and I, we are very interested in how, so we have generally 3 questions. The first one is, what are the cultural interpretations and meanings of a healthy aging? Because for immigrant families, for children, they were born in the United States, they get education in the United States, but for the immigrant older adults, they have different meaning and different education background, so they maybe have different understanding, a different interpretation about what's aging, or what's healthy aging. So we're going to ask their perspective. We asked their perspective about this from 2 generations. And then we ask them about what's the approaches and strategies for achieving and maintaining healthy aging in minority community, still from both perspective of the younger and older generation. And then we ask broadly how cultural and ethnic minority status influence their experience in achieving healthy aging, the process. So we are very broadly interested in minorities, but we start up with interview 15 diets of Chinese immigrant families. And we have a lot of interest findings already. For example, there's a lot of disconnection between older and younger generations about their perception, about service utilization, and about their understanding about health and aging. So very different, but also very interesting. But we also found very common barriers about social service utilization, such as transportation and language barrier. Both the parents and older and the other children caregivers, they mentioned this. So we are thinking about our next step. So these are already a problem there, but that's only for Chinese older adults. We may apply this to other minority, like other Asian population, or Latino, or African American, or not African Latino, to see whether that's also a common problem for them. And then we can think about how to, if yes, then we need to think about how to improve the service utilization, such as maybe design an app about language translation, or like Noelle just mentioned, other transportation program to help the minority older adults. So this is my third project I mentioned about my recent research. I think I'm very fast. Okay.
Oh, that's great. Yeah. No, that's good. So we wanted to share a little bit about our new faculty in aging. We have a couple here today.
Maybe before you go on, maybe you could just have, if anybody has questions.
Oh, we had a slide for that too.
Okay. It's
Oh.
building up a lot of information, so.
Oh, okay.
People sometimes forget.
We wanted to just talk a little about the folks that are here and their interdisciplinary research ideas, which might provide some fodder for collaboration. We have Dr. Malden and Dr. Lee here. I'll pick on you all in just a second just to quickly share about yourselves and your research. But we also have Dr. Cobb. He couldn't be here today. He's also a gerontologist. He's very interested in health. He's interested in cardiovascular disease, interested in health disparities among African Americans. And so I know that he is very interested in collaboration around those kind of definitely health-focused outcomes. He's also very familiar with secondary data and some data sets that look at this specifically for minority populations. And then Dr. Cong, who is going to be here and couldn't today, she studies, it's very interesting, her work. She collaborates a lot with engineering. She came to us from Texas Tech this year. She looks at disasters, things like tornadoes, and their impact on the community, specifically older adults, related to their health, related to their wellness, related to just recovery efforts. So she has done some very interesting projects and has actually, I think, still an ongoing project that's funded by NSF to look at the specifics about disasters, particularly tornadoes, and their impact on the community and older adults. So I wanted to give you guys just a second to share about yourself and your areas of research as an idea and platform for collaboration with the folks here. You want to start, Dr. John? Okay.
Hello, everyone. My name is Rebecca Malden. I came here from the University of Houston. I specialize in the social relationships of older adults, particularly peer relationships and how that influences their health and well-being. I look at relationships among residents in long-term care facilities, social support, and particularly interested in opportunities for adults to give social support as a way to enhance their well-being. My specialty is in social network analysis, so I really like to look at things like social influence and contagion and adaptation of new ideas and the way in which social networks are structured and how that influences outcomes. So that can be organizational networks in which different service agencies work with one another. We can look at caregiver networks, coordination of care, and then also relationships among individuals. So those are kind of some broad ideas that I'm interested in.
Thank you.
Hi everyone, I'm a new assistant professor at the School of Social Work and my name is Kathy Lee. I got my PhD at the Ohio State University. I'm very interested in health and mental health of older adults with cognitive impairment and older adults with physical disabilities. And I've done some research around utilizing some non-pharmacological interventions for older adults with cognitive impairment and also physical disabilities, such as equine-assisted therapy and meaningful social activities such as volunteering. So my dissertation was around actually looking at the health and cognitive health impact of volunteering among older adults with cognitive impairment. And actually recently Dr. Malden and I received a small award to develop an app that kind of helps older adults with cognitive impairment and physical disabilities living in their own home connect to volunteer activities in their community, so that because they may have some difficulties traveling to their volunteer sites, so that they can but still maintain their engagement to the community through this technology. So we are actually planning to implement that study hopefully next year. I'm also very interested in disparities in health and healthcare system. So I'm currently examining some the relationship between Medicaid and how Medicaid helps social engagement of low-income older adults. So I'm enjoying working with students, and I'm always looking for more collaboration with other faculty members. So if you have any similar interest in my research work, feel free to reach out to me and also Dr. Malden, because we also share some similar research interests together. Thank you.
Great, thank you. So I know we threw a lot out there between new faculty talking about some of their work and social networks and app development and civic engagement, technology, transportation, persons with cognitive impairment, culture issues, minority population. So I just wanted to spend, I know we don't have a lot of time, but just a few minutes thinking about any ideas you might have for either the projects we've talked about, ways that we could better, again, the purpose of the panel or the talk is about leveraging interdisciplinary collaboration. So do any of you have any thoughts or ideas about ways that your college could work with social work on some of these projects like these? No one? Yes, I think it's so.
Okay, Dr. Field, I just have a question about like your RPT. I'm just curious because you mentioned that that's a partnership with the Louisiana and Texas, right? That's Arkansas. So is that the multi-site?
It is a multi-site study,
Okay.
which brought
Just curious,
some
yes.
some large challenges that
Okay.
we had not anticipated having an outside board, which we luckily put together.
Oh, a lot of work.
Yes. Yes, ma'am.
I have a broad question.
Okay.
Which may lead to some ideas.
Okay.
But, so I just really thank you for presenting. I think it's fascinating, just hearing about the work that you're doing and the leveraging of technology with aging populations. And so with listening to some of the projects, obviously thinking about not only the cultural but generational gaps in terms of technology, particularly robots, right? So could you speak to maybe that experience or maybe expectations with some of the future projects of how, just working through that part and what that's been like or what you expect?
So it's a really good point, and even, for instance, with our transportation app, there was a lot of concern about are older adults going to be able to even use this? And we actually had a population for Meals on Wheels that were had high healthcare needs, among others, so a very kind of at-risk population. But I think for both projects, whether it's robotics or the app, we carefully designed trainings around the technology. So the app, we had a standardized manual we went through and screenshots and really worked, the GRAs really worked with the individual about that. And there's a lot of troubleshooting. For the social robotics, I hear you because it is, there is sometimes fear about what's this technology, even with with our project that's with the older caregiver taking care of their adult child with developmental disabilities, there's some hesitation about having that technology the potential that it would be in my home. Now in our study it won't be in their home, but I think part of it is just we started out in a very exploratory way, introducing the participants to the robot, getting their feedback about it. So even in our study with Shakespeare and robots, we found interesting differences. Seems like the person's well, I don't know, I could say interesting differences, but there was some hesitation when we explained the study. And then once they came and even interacted the first time, there was kind of a wow factor. Now, for one thing, we particularly chose a robot that's smaller. I mean, if you put him on the table, it's only this big. So we took into account things like perception of size, the sound of the voice, kind of things that might help kind of calm anybody's fears. So we did take that into account, but I think that's a very important part when you're thinking about what population you're trying to reach with any of the technology is, how we present it and how we design it. So I think that even speaks to this idea of leveraging the collaboration. I mean, we had folks from computer science who are brilliant at design, but they would maybe admit, I don't know how this is going to work with an older person. Whereas Ling and I brought the gerontology perspective to say, well, in our work with clients and our work with other research participants, this is kind of what we hypothesize might happen. How can we build in sort of protections about that and ethical issues that might come up? And then having liberal arts to talk about the artistic value, which is the part that really engages the participant, that would capture their interest right away. Because there's a lot of beauty in the, sounds strange, but there's a lot of beauty in the robot and the activity aesthetically. So, but it's a great question. Hope I answered it okay.
Have you only looked at this in like individual homes, or have you done some more like community-based homes, like nursing facilities, where you've got a whole bunch of older people all in kind of the same situation? Because I feel like some things like the robot might do well in a small group-based thing, where you have that first interaction and the people people that you're trying to study can interact amongst themselves and start to foster more of that interpersonal communication.
So it's a great point. We, in the Shakespeare robot study, we worked with Brookdale. So those are our residential care facilities. Although it was not a group intervention, it was individual. What we did at the end, though, after the intervention was over, we actually did invite all of the residents to come and look at the robot and see sort of another type of demo. And it was very fascinating to see folks that you could just read their body language that at first were not interested at all, but in the end wanted to. We have actually an opportunity to shake the hand of the robot. People were like in the line. They wanted to touch the robot. So it was really, in particular, persons with cognitive impairment. I mean, it was really, there was some, in that sample, just some, hesitation, and then the group seemed to sort of open up folks that weren't participants, but we could just sort of, we had kind of anecdotally looked at that. I think the idea with any of the robotic stuff is that eventually this technology will be in people's homes. I just think it's the reality. I mean, who would have thought we'd have the iPhones and we have all the opportunity to do everything we do with technology today, very much in our home, right? So I think trying to design things that down the road are going to be accessible and affordable, and that persons are going to find useful in a home setting is going to be a challenge, but at least we're starting where we are. So the SAR project that Ling mentioned with the parents and the adult children with disabilities, that's going to be taking place at the agency. So for that, there's some familiarity with the agency, with the staff there, and a comfort in knowing, okay, the agency sort of endorses these folks coming in and showing us the technology. So that was sort of, I think, it enhanced our ability to recruit some people, although that we've had a lot of challenges with recruitment on that one.
So, a couple quick thoughts. I'm sort of a basic biology of aging kind of person, and one of the things that would be interesting. There's a study called the Handle study in Baltimore, and they actually they did a lot of community-based things and did like longitudinal health outcomes, and I think some more qualitative kind of research, but then they also combined it with some actual biological outcomes. And I thought that was a really great model. And the second thought, and sort of along those lines, would be, this may just create more work for myself, but if there's an interest in a UTA, like campus-wide aging research day, I think that would sort of be a good next step in leveraging some of these collaborations where you could have, a couple talks on biology, a couple talks on social work, a couple talks on
That's
whatever,
a great idea.
and then have students do posters, etc. I think that would be a good way to kind of get some of those things going.
So to your first point, yes, I think I would love to incorporate, and I think Ling and I talked about this, more kind of biological aspects, whether it's measuring cortisol levels or all the kind of things that are out of our realm that are more in the realm of nursing and maybe in kinesiology. So I think some of the projects as we move forward, we'd really love to talk with folks that are interested in those sort of aspects of the research. And then to your second point, I think that's a great idea, and we can talk with the associate deans for research at both of the schools, among others, or maybe some others, that I think that'd be great. Opportunity for faculty, but also for our students. We have so many students involved in these projects, and I think for social work, we're also trying to encourage students to move into the field of gerontology. Really trying to recruit students that want to work with older people in practice, and then go on to perhaps get their PhDs in gerontology. So, great idea for the day.
An opportunity for presentations is March the 8th. The Nursing Honor Society, Sigma Theta Tau, has our research day here. Last year we had 33 posters and several presentations, and we are looking for interprofessional collaboration, but we blend with kinesiology, College of Nursing, external presenters also. So March the 8th, put that on your calendar. I'll send you a call.
Good. Great. So we have students that would, I think, really enjoy presenting. So great. I know there's someone else.
Yeah, it's too bad I don't think Kathy Daniels is here, but she has
Yes, we know her.
Kathy, her smart home.
Yes, smart. Yes.
She's at the geriatric conference right now.
Yeah. We do some work with heart failure patients, and they do have, I should be careful when I say this, but probably have some cognitive deficits as well. And it's one thing we never measure because it's totally out of my realm. It'd be interesting to maybe connect somehow. And also there's a social aspect to what we do with exercise.
Yes.
They don't come to
Yeah.
exercise, they come for the
Right.
social.
Right.
So we know exercise works, but they're not coming to see us.
Just for that.
They're not coming for exercise. They're coming to talk to Wes and the nurse and
Mhm.
tell a story. But we don't actually capture that. And
Yeah.
I think it's really important that we have captured the social aspect
Mhm.
because I can honestly tell you, having done it for 2 decades, they're not coming to see me.
Yeah.
They're coming to hang out and tell us a story, but
Right.
we don't ever capture
But that's a
that
very
component.
important variable to look. It's a very important aspect of our
If
lives.
we're gonna have adherence in the long term, we need to capture what's
Yeah.
keeping
What
the
keeps people
social
there?
aspect of it.
Yes. And what is the benefit of the social aspect on health outcomes? It sounds like even some of
Right.
Rebecca's social network stuff would be helpful, so y'all can connect.
And it'd be kind of interesting because your colleague who does some of the work with, I think you said tornadoes or
Mhm.
hurricanes, be interesting, he might get some Takasugo or something, because there's a lot of stress related to that, and people can have heart attacks acutely with major stress.
Mhm.
So I think there's areas synergy with some of our physiologic measures. with
Yes.
The measures that you potentially do that we have no clue.
Yeah.
And might be home run hits, really.
I think so. I think there's so much opportunity at UTA for us to work together. And for all the faculty here, our research is particularly around older adults, but really older adults is about family caregivers. There's a lot of intergenerational, so it doesn't always have to be just so focused on outcome for older adults, but on their social networks and other aspects. So we really would value and welcome, a big day, collaborations, looking at different calls for grants. Certainly anything that students want to learn about and be involved in. There may be opportunities to work on some of our projects or our students to work on yours.
And do you, sorry, so with cognitive like, we also work with cancer patients, a lot of them, they get chemo brain, but no one's really characterized that well. So do you have cognitive measures that you guys do that could sort of uncouple some of this, so like memory kind of things?
I mean, there's certainly instruments for memory. I mean, you guys know.
MMSE.
Yeah.
MMSE is a common measure to measure cognitive functioning, and one of the big data set called a health and retirement study utilized TICS. It's a telephone survey based. So, but that's mainly in the field of like people use MMSE, like in long-term care facilities.
Yeah.
Are you specifically saying something that looks at medically induced memory, brain fog, chemo brain versus?
I have to pause, I'm not sure what I'm saying.
Okay.
But in full disclosure, I'm not sure a lot of people do either.
Yeah.
It's
Right.
anecdotally people tell us this.
Sure.
Right.
But we don't really have to measure
Measures,
the
so.
metrics of it.
Right. Even
So,
that MMSE doesn't necessarily like measure their cognition, but also it's basically based on like mental health status in general too.
So it's there.
Yeah.
Right. So opportunity there.
Very much so.
Yeah.
Is anyone else? Oh, yeah, go ahead.
I guess I'll just throw it out there. So I know, I think Kathy and a few others talked about just the work with aging and health disparities. And so a lot of my work is in health disparities, mostly with women, reproductive age women, but very in tune with the life course perspective. And so if there is any interest in kind of intergenerational or reproductive age women and aging women, that is wellness.
We actually have a new doc student who's interested in postpartum depression among Native American Indians.
Okay.
So it's absolutely,
Okay.
health disparities is a big thing in all sorts of aspects. So.
The robots you guys developed and the app program already developed, can you add more information, like to measure symptom monitor, or okay, the robot can place a breathing exercise, demonstrate the patient, because that robot can be going to home base. Would you like to share with me? Because I'm interested in how to deliver the symptom monitor, which is breathing technique for high failure patients with the perhaps.
Yeah.
So that would
Be great. I know, I mean, I'm not the expert on that. We work with Pepper, but the computer scientist and then Dr. Greer, but I know that, that's what we're doing. We basically design, it takes a while, but these robots are very advanced, especially Pepper. It's like a newer one that not very many universities actually have, because he has the touch screen, because he has the ability to actually move. He's bigger, like when he's standing, it's like probably this big. Hands like it's actually considered a humanoid robot. The other one's kind of it's sort of humanoid, but looks a little more like a toy. But there's definitely opportunities to be involved, because that's what we've done in our projects. Is we've said, can we even do this? Can we even design something that's going to be?
I think that there will be my next project.
Good.
Utilize your robot already developed. I don't need to develop a new one.
No, you just have to.
Building
It has all the coding and everything, and we work with computer science and Utari to help us write the code. So we all are at the meetings to talk about design and implementation and evaluation. So we make sure we get all the different disciplines together to talk about, did this work well?
Yeah.
So that would be great.
Okay, I think one there, I just would add one note. I think collaborations are always a challenge, and I think part of it is people just want them to occur. What you all did today was fantastic, because we all now have a better appreciation for what you do. So my suggestion would be, I think aging research day is a great idea, but I also might say maybe before the end of this semester, we have another symposium or seminar session where I can coordinate with the 5 or 6 or 7, some people aren't even here, who are focused on aging from the biology side, cardiovascular side, and then maybe we can present something similar to what you did, and then you know more about it. Because I think you have to know what we do in order to put it together. And I think that's always a problem in collaboration, because you have a general idea, but you're not sure of the specifics, and this was a good way to get us
I think
to
that would be
understand
fantastic.
So we can try to coordinate that. I'll put Dan in charge, because he really has a lot of aspiration for pulling us together.
All said, we've all tried to collaborate, and I think the key is you really have to find people who say and do what they say they're going to do.
Sure.
But I can tell you, this group follows through. Like we do what we say we're going to do,
Right.
and that right at the outset, because we can all try to collaborate.
Right.
There's only one doing it, but I can't say this group is hardcore doing what they say they'll do.
So, and I think for us, we value so much of the teams building the rapport and the trust. I mean, we're very close with with our interdisciplinary partners, and that's the spirit of collegiality, supporting one another, and meeting the missions of the university in terms of our strategic planning. So it definitely would benefit us. Like, I'll read about somebody here is an R15. I'll read about some stuff, but I don't know that person. And
It's
so
really a way to make strong proposals, because I think when you talk about interdisciplinary, multidisciplinary, whatever you want to call it, when people review grants that are that way, it's obvious when they're not clearly collaborating.
When they just threw the name on
That's
there.
right. It's
So
very obvious.
we try to build track
So by learning more,
records.
that's right, we would be able to put some strong
Yes.
things together. So anyway,
Thank
we'll
you.
end with that. Please join me in thanking everybody.
Thank you, Dr.